So why do I need treatment, you say? Well, in fact, what is treatment? Um, we we know that addiction, or we used to call addiction and now we call substance use disorders, is a biological, biochemical disease. So medical treatment's appropriate for that. And here at Shepherd Hill, we have a philosophy of treatment that we find to be very effective. Now, everybody knows that there's dozens of treatment centers around. In fact, there's hundreds in the state of Ohio now. 10, 15 years ago, there was nowhere near this number of treatment centers. In fact, there were only a few. And they were mostly treatment centers that were focused on actually treating the disease of addiction. Nowadays, you don't see that. There's a lot of treatment centers that actually don't provide any treatment. So what is treatment? Well, treatment is the process by which we get patients to go from being in active use to being in recovery. And here, what we emphasize is 4 primary goals of treatment. One is what we call a self-diagnosis, meaning I have become convinced that I have this substance use disorder, that I have an alcohol use disorder, or that I have an opiate use disorder, or whatever. I have this disease. That's a self-diagnosis, because I can tell patients all day until I'm blue in the face that you have this disease. But unless they believe that they're not going to do what they have to do, because what it takes to get clean and sober isn't easy. Simple, but not easy. And so they're not going to do it unless they're absolutely convinced. If you're not a diabetic, you're not going to inject yourself with insulin. And if you don't believe you have a substance use disorder, you're not going to get the treatment for it. So we talk about self-diagnosis. We also talk about self-responsibility and self-treatment, which means that you, as the patient, are responsible for treating your disease. No one else is going to treat it for you. You have to take the responsibility to treat your disease. And that's self-responsibility for self-treatment. And the last, and one of the things that we really emphasize here, perhaps most important, is education. If you're diagnosed with a disease like hypertension or diabetes or asthma, you're going to get education on that disease. You're going to be taught what it is that the disease is, how it affects your body and your brain, and what you have to do in order to stay safe. If you're diabetic, you're going to get a lot of dietary education. You're going to get lifestyle modification education. You're going to get all that. Well, if you have a substance use disorder, you're going to get education too. You're going to learn what safe behaviors are and what unsafe behaviors are. You're going to learn how to change the way you do the things that you do so that you can continue to remain abstinent and in recovery. And those are the 4 things that we emphasize most in treatment here at Shepherd Hill. And that's one of the reasons why our treatment program is so successful. Because a combination of that type of treatment with medication that perhaps you'll hear about later, we have found to be extremely effective at putting the disease in remission. Now, does it stay in remission 100% of the time? Absolutely not. Substance use disorders are chronic, progressive diseases that are ultimately fatal. And as they are chronic and progressive diseases, they are like most chronic and progressive diseases in that there are relapses. And although it's not necessary for a patient to relapse, it is common. And so I can't say that I expect it, but I am not surprised when we see this. And relapse doesn't mean you're a bad person and there's nothing we can do. A relapse simply means you need more aggressive treatment. It means you have a more severe form of the disease. If you had cancer and you had some form of treatment and then your cancer came back, the doctor would recommend a more intense form of chemotherapy, not less. And so that's how we treat this disease. If your disease comes back, if your symptoms come back, then you probably need a more intense form of the disease. And that's how we approach addiction treatment here. And our patients receive this treatment sort of in a number of ways. We have what used to be called inpatient treatment, or we now call partial hospitalization, where you stay all day. Some patients stay overnight. Some patients just do outpatient treatment. And we also have clinic patients. But that's what we do here at Shepherd Hill. And more about that later. And that's all I've got to say about that for now.